Good evening, and thank you very much for your partnership in this historic public health effort in New York State. I'm Dr. Howard Zucker, the New York State Health Commissioner. I'm joined today to my left by Megan, who is the former secretary to the governor. To his right, Kristen Proud, also a member of the New York State Vaccination Task Force, and also Gareth Rhodes, to her right, who is a deputy superintendent at the Division of Financial Services and has been working with us on the COVID response. With continuing shipments of allocated vaccines from Pfizer and Moderna, the state is moving ahead in our massive operations to vaccinate every eligible New Yorker as soon as is humanly possible. It has been a long 10 months since the beginning of the COVID-19 public health emergency was declared in New York. All of you have worked tirelessly throughout this time, providing essential health care, public safety, and educational services, despite the challenges of COVID-19. The latest challenge that we face in the battle against COVID-19 is both exhilarating and daunting, vaccinating 19.5 million New Yorkers. Exhilarating because we have been talking about safe, effective vaccines since the toughest and the darkest days of the spring surge last year. And it's daunting because so many parts of the healthcare system already have their hands full with critical aspects of pandemic operations, or the patient's treatment, diagnostic testing, and contact tracing, and are now needed to administer the vaccine. Our mission is also daunting because a segment of the population remains reluctant to take a COVID vaccine. So we need to persuade them otherwise. We are racing against the clock to get needles into arms faster than infections can spread. And because of a second wave fueled by 2 months of holiday gatherings, COVID-19 is spreading with phenomenal gusto in every part of the country. And it could take off even more via the super contagious B.1.1.7 COVID variant from the UK. As of Saturday, New York has reported 4 cases of the UK COVID-19 strain, 3 in Saratoga Springs and 1 on Long Island. New York State will rise to all the challenges of this mission and continue to lead by example with help from all of you. On December 11th, the FDA authorized emergency use of the Pfizer Bioentec COVID-19 vaccine in individuals 16 years of age and older. The vaccine requires 2 doses with 21 days between doses. Its efficacy rate is 95% in phase 3 trials, consistent across all groups. On December 18th, a week later, from the December 11th authorization, the FDA authorized emergency use of the Moderna COVID-19 vaccine in individuals 18 years of age and older. Let me clarify that. On the Pfizer one, it was 16 years and older. On the Moderna one, the vaccine required 2 doses with 28 days between doses. Its vaccine efficacy was 94.1% in phase 3 clinical trials, consistent across all groups. Since ICU nurse Sandra Lindsay became the country's first COVID-19 vaccine recipient on December 14th, New York State has been all systems go in getting the vaccine out to the 2.1 million New Yorkers in phase 1A. We consider this a wartime mobilization in that lives are on the line every minute of every day. A wartime operation is a 24/7 operation. It starts early in the morning and it goes until late at night, running throughout the weekend. A wartime operation also enlists all available allies to get the job done faster. And that's where each of you come into the picture with the public health mission of a lifetime. State-operated pods, county health department pods, hospitals, federal qualified health centers, urgent care centers, ambulatory centers, pharmacies, physician networks, and practice group sites, and employer-sponsored pods. As a statewide network of providers, you will be a critical link in this massive distribution chain. Today, we begin the vaccination of a subset of the over 4 million eligible New Yorkers in phase 1B. To win this battle against COVID-19, we need between 70% and 90% of the population to get vaccinated. Your partnership will also help substantially in our public education campaign to convince New Yorkers that approved COVID-19 vaccines are safe, effective, and equitably distributed. We hope this webinar provides the information you need to move forward in partnership with the state to get New Yorkers vaccinated. In the weeks and months ahead, the department will remain in close contact with providers to update you on all the details of vaccine availability and distribution and vaccine guidance. I am confident that the dedicated network that you are helping New York State establish will be a critical factor in implementing a safe, equitable, and efficient vaccine distribution system. Thank you again for this great service on behalf of the people of New York State. And I will now hand it over to Larry Schwartz to discuss the key elements of the state's vaccination program. Thank you.
Thank you very much, Dr. Zucker, and thank everyone who is on and attending and participating in the webinar today. Excuse me. One of my goals here today is to help clarify anything that people are either confused about and try to prevent any misinformation about how the program is meant to be run and your role in participating in getting the people of New York State vaccinated. So the first thing I want to do is just go through with all of you who's eligible to date to be vaccinated. As you know, when this program first began back on, I believe, December 21st, when we got the first Pfizer allocation, healthcare workers, especially those in high-risk situations, were given priority in terms of receiving the vaccination. But as you can see here from this slide, and there's a few that I'm going to go through, the list of people that were originally eligible and fall in the kind of hospital healthcare category is quite large. From the video that you saw with Governor Cuomo that we'll have posted, so if any of you didn't have a chance to see it or see it in its entirety, we'll make sure you can see it again. It's 2.1 million New Yorkers. And you can see here from hospital staff to EMS workers to federally qualified health center employees. The list is very extensive. And as you can see, as we continue to go on, there are physicians, home care workers, hospice workers, therapists, dentists, and other people that fall sort of in the healthcare. In addition to that, included in under 1A, or the 2.1 million New Yorkers, is the disabled community, those that are residents as well as staff that live in congregate settings. And last, of course, is we have our nursing home residents and staff and our other long-term care facility residents, primarily that live in assisted living facilities. So again, that was the original rollout under 1A, and we continue to prioritize them, and I'll get to that in a minute, as the vaccination plan continues to go forward. So these are a critical component because obviously we need all these people at their job sites, especially during this recent COVID surge again, to make sure they can take care of the sick, especially those that end up getting COVID. The governor just recently announced that we were expanding the eligibility groups in the vaccine rollout, and there are primarily two eligibility groups. One is people that are 75 years and older, and then we have a whole list of essential working groups. You can see from the slide that I have in front of you, it lists out who those essential working groups are, and there's subcategories in each one. So you see under fire or police, especially police, it's quite extensive, state police, local police, sheriff offices, and I'm going to just keep going. It shows you corrections is state corrections and local corrections. In the education categories, it's K through 12, it's teachers, it's other people that fall within the education category. You see under public transit, you have mass transit, you have airlines, you have subways, buses, ferries. So it's quite extensive. And as the governor said in his video, between the 1A group of healthcare workers and the 1B group, which is only partial, right? There's more to come. You're talking about 5.3 million New Yorkers. And clearly, as the governor pointed out, that we're not receiving anywhere near enough doses to get to all 5.3 million immediately. We're receiving 300,000 vaccine doses a week. So as the governor again pointed out, if you do the math, you're looking at a 14-week period to try and vaccinate somewhere between 70 and 90% of these different categories and population groups. So we'll make sure that these lists are posted. So in case you have any questions or don't remember who all these categories are, you'll be able to look it up. Now I want to talk about not only eligibility, but where these eligible groups need to go in order to get vaccinated. So as the governor again pointed out, if you're 75 years of age or older, our pharmacy sites will take reservations so our seniors can get vaccinated there. Eventually, we're going to start being able to provide vaccine doses to our physician provider groups as soon as the federal government increases our allocation of doses. And the other place where seniors can go is they can make a reservation on one of our state-operated pods. I think to date we have 5 open. We're going to build 40 state-operated pods throughout the state. And I'm going to get to in a few slides how you can set up an appointment on one of our state-operated pods. But that's another place where people 75 years of age or over. So again, pharmacies and our state-operated pods. In addition, as the governor again pointed out, we want to make sure that our hospitals, who have done a great job, as well as our federally qualified health centers and urgent care centers over the last month, they continue to prioritize and really must prioritize healthcare workers first. And once they get through that and they still have additional allocation of vaccine doses, then they can schedule 75 plus and other essential workers in the 1B category. But again, we want all hospitals, FQHCs, and urgent care centers to first make sure that all eligible healthcare workers under 1A have the opportunity to get vaccinated first before you go and schedule appointments for those that are 75 plus or in a essential 1B worker category. And again, where can essential workers go to get vaccinated? Again, basically 2 locations, whether you're police, fire, work for a school district, you're a teacher. One is you can make an appointment or organize it through one of our state-operated pods. The other option is working with our local health departments throughout the state, our local police, fire, corrections should contact the local health departments and schedule their employees and their workers to get vaccinated. The governor pointed out that based on our allocation, again, it's going to be 14 weeks. So I would say to every local police, fire, and every essential working group that you look at prioritizing your own employees each week because of the limited allocations we have for each group, and to figure out who you need to get vaccinated first and then second, third, and so on. And also for the unions, if you have arrangements with local hospitals or other types of healthcare providers through your employee benefit fund or some other mechanism, and you want to arrange through them to get your members vaccinated, then you certainly can do that. We'll work with you on that. You could set up your own sites and you can work with the healthcare provider that you have a working relationship with, and we'll work to get those appointments scheduled. You certainly can also work with our state-operated pod sites as well to get your members vaccinated. And again, because of the limited supply and allocation from the federal government, I would ask you to think through how you prioritize your own members. Clearly, we're hoping over the next few weeks or months that the federal government will find a way to significantly increase its allocation of doses, whether it's Pfizer or Moderna, which are the two vaccines right now, so that we can actually increase the number of individuals in both the 1A and 1B essential worker category, and hopefully be able to expand the number of essential employees in those groups. Again, I just want to emphasize again that, hospitals, FQHCs, and other urgent care centers, please make sure you prioritize healthcare workers before you start scheduling 75 plus or people from the other essential worker category. And again, you can also schedule through the state, one of our state-operated pods. There's a number of ways that you can book an appointment. First of all, the state has a tool now up on its website. It's called the Am I Eligible tool. This allows you to go on site and find out whether or not you are eligible to get a vaccine shot now. And you can also find out where there are locations for you to be able to get the vaccine shot. In addition, if you're a senior, 75 plus, or you're someone else that you feel is you're eligible to get the vaccine shot, you can also call the New York State call center, and you can arrange or schedule an appointment through the call center, or the call center will assist you in telling you where you can get a vaccine shot from your local pharmacy, or where to go, and you can schedule an appointment with your local hospital. Clearly, also, your other option is you can call your local pharmacy yourself to schedule an appointment, or you can call your local hospital if you're more comfortable going there. And again, if they haven't already scheduled healthcare workers and they have space available, you can then schedule an appointment with them. I also want to just emphasize that everyone that's going to get a vaccine shot must complete the New York State COVID vaccine form. That vaccine form is online, and you can see from there the vaccinehealth.newyork.gov. I also just want to emphasize to all providers, it is essential that everyone is always ready to go and to give those vaccine shots. We want to make sure that each week, if you receive an allocation, regardless of the size, that you're able to use up your entire allocation in a 1-week period. And in our guidance, that at the end of the 5th day of the week, if you feel that you're not going to be able to use up your entire allocation, you're to call the state health department, and we'll look to reallocate whatever vaccine you don't think you're going to use. It is clearly essential, and I want to just stress the urgency, that we work as fast as possible to put a shot in every New Yorker's arm. And we don't want to see any doses on any shelves and holding back on any inventory. So each week we get an allocation, and we want to make sure that entire allocation is used up on a weekly basis. Again, here are the things you need to bring with you to your vaccination appointment. Also, here is some additional information, and you'll get a card. So when you go and get your first shot, you'll get a card on when you need to return for your next appointment. In addition to that, you will receive text messages to remind you of when you need to return. And it's essential that you return to get your second shot in a timely manner. Again, I just, want to just emphasize that protection from the vaccine is not immediate, and you can see that you need to take both doses, and it'll take 1 to 2 weeks following the second dose for you to be fully vaccinated. Again, continue to wear a mask, continue to social distance, and you really need to follow all the guidelines, even in a post-vaccination era. We put out guidance, and I just want to emphasize this is another point where some people were confused, or there may have been some misunderstanding. We don't want one single dose of vaccine to go to waste. So it is essential, regardless of what type of provider you are, that you have a standby list in addition to the appointments, where all of you are going to, at one point in time, have cancellations. So you need to make sure that whether you have one or more cancellations, that you can then immediately contact your standby list and have them come in. So that if you open a vial, whether it's Moderna or Pfizer, and whether it's 6 or 11 doses in that vial, you're able to administer them to somebody that falls within these two eligibility categories. So again, it is essential that you have a sufficient standby list in addition to the appointments that are being scheduled, so that when you do get cancellations, you can immediately go to your standby list and continue to do vaccinations. In the event that you've gone through your appointments and you've gone through your entire standby list and you still have an extra dose, then you're allowed to give it to one of your employees that work there. We gave an example of a pharmacy that after, if there was a snowstorm and people canceled and you went through your appointments and you had a number of cancellations, and then you went to your standby list and some people couldn't come in because of the weather, then it's okay to vaccinate a cashier or some other employee that works in your pharmacy. We don't want a single dose to be wasted or go to waste. So please make sure that you have a system set up to prevent that from happening. There are two ways that we are asking everyone, all our providers, to report the administration of their number of vaccines that they're administering on a daily basis. One is through the NICE New York SIS system, and the other one, if you're from the city of New York, it's the CIR system. The New York SIS is for the rest of the state, but in addition to that, the state has created a COVID vaccine tracker system, and that requires daily reporting. I just recently sent out an email to all our providers emphasizing that everyone needs to respond to the questions. It's about 5 or 6 questions, shouldn't take very long on that. And I'm asking that those responses be submitted to us by 10 a.m. every morning in order to produce a report. I go through those reports on a daily basis to monitor inventory and to monitor vaccine activity. And I appreciate I've gotten a lot of emails with questions and comments already from my email that I sent out. But we need you. It's mandatory that you both report on the state and city systems, as well as report on the vaccine tracker questionnaire that you receive every day, so we can fully monitor and track progress and whether or not anyone has any inventory. Again, I just want to emphasize the goal here is not a single dose of vaccine is available, and the issue is we need more from the federal government. So let's make sure each week we use our full allotments. I'm just giving you a chance to take a look at this. Vaccine redistribution. Sometimes there are situations where a provider wants to redistribute vaccine to another provider. And we're fine with that as long as you fill out the form that the state has given to all of you. You need to fill out that form requesting permission to reallocate or redistribute any vaccine that you as a provider were allocated. You cannot redistribute or reallocate any of the doses that you were given unless you first get permission from the state in order to do that. Anyone who transfers any of their allocation, whether it's the city of New York or anywhere else in the state of New York, you're in violation of the state guidance and your state MOUs, and you run the risk of not remaining in the program or not continuing to get allocations in the future. So this is really important that, one, you report on your daily activities, but more importantly, that if you want to move any of allocation along, that you first need to get permission from the state of New York. If you're a hospital system, the state will work with you to give you permission to move vaccine allocations within your system. But if you're not a system and you're an individual hospital or you're some other type of provider, you must fill out that form, and the systems must get pre-approval if you want to move it around within your system, and let us know what you're doing. So that's key. Otherwise, I just want to emphasize, you run the risk of not being eligible for future allocations as part of the vaccine rollout program. So this just shows you that if you're bringing something on a temporary basis or to an off-site clinic, that's not considered a reallocation, okay? Again, this tells you how you go through the process. And last, I want to put here, these are just different resources. So again, if you have any questions, here's places where you can go and get some information. If you have any, and clearly, while we're going to try to answer some questions that were provided to us this evening regarding the program, I'm sure many of you are going to have questions after tonight's webinar. Here is where you can submit your questions. I promise you we will turn and get you answers in a very timely manner. If you have any questions that you need answers on in terms of working with us and being successful. So again, I just want to emphasize that the state imposed a use it or lose it policy. I alluded to that in my comments. That is why we need you to utilize your full allocation each week. If you receive an allocation, and regardless of the size, you need to use it up in 7 days, or you run the risk of losing it. You also run the risk of getting either no allocation or a smaller allocation in the future. Please do not turn people away. As the governor indicated, based on 5.3 million people and getting 300,000 doses a week, you're looking at a 14-week rollout. Hopefully that'll be shorter if the federal government can come through. Again, we are restricted or hamstrung by what the federal government gives us, and sometimes they actually give us less than what they projected to do. So, but let people schedule an appointment, even if it's 3 weeks from now, 8 weeks from now. Do not turn people away. Get them scheduled. Clearly write or call us if you have any questions. And again, I would ask our union that you're free to organize your own locations and work with your own healthcare providers. You can work with us at our state pods, work with your local health departments. I would ask each of the essential working groups, again, work with your local health departments and scheduling the vaccine shots. And again, as I alluded to, our pharmacies are doing 75 plus only. Our state pods are doing 75 plus. Essential workers and healthcare workers in hospitals clearly are prioritizing, along with the other health providers, first healthcare workers under 1A, and then if they have available vaccine and an open schedule, they can schedule 75 plus and other essential workers. So again, thank you for participating tonight on the webinar. I hope this was helpful and it was able to provide you with more clarification and more clarity in terms of the guidance that everyone needs to follow. Let's all work together to make New York State's program the most successful program in the country. Thank you.
Thank you, Larry. Thank you very much. I'd like to go to the question and answer session, and Megan Baldwin will lead that session. Thank you.
Thank you, Dr. Zucker. The first question comes from Jenna. And Dr. Zucker, I'll turn this one over to you. Is the vaccine effective for those who have already had COVID-19?
Yes, the vaccine is safe and effective. The one thing I would recommend is that, and the recommendation of the CDC, if you had COVID at that moment in time, when you would wait to get the vaccine until you are out of isolation and until your symptoms have resolved.
Great. And as a follow-up to that, is there a period of time you must wait from a COVID positive test until you can be vaccinated?
So the recommendation for those who have had COVID is to wait. You could wait up to 90 days. As I mentioned before, I would wait until you're out of isolation and you don't have any more symptoms until you get vaccinated. But the CDC says you can wait even up to 90 days because your antibodies will be around at least for that period of time, if not longer. So that's the recommendation.
Okay. Dr. Zucker, one more, and then I'll switch gears for a moment. What does one do if they cannot register for the follow-up dose in the recommended time frame? So 21 days for Pfizer or 28 days for Moderna.
So with the recommendation is that you should not get the vaccine much earlier, maybe a couple days earlier, but not much earlier than that for the Pfizer and the Moderna vaccines. But at the other end of that, you could wait a period of time after that to get the vaccine, although we obviously recommend 21 days and 28 days, but the outset could be a little bit longer.
Okay, the next question is from Thomas. I am a primary care provider, and I'm interested in registering in the New York State's vaccination program. What should I know before I enroll as a provider, and how long from enrollment until I receive vaccine? Gareth, I think I'm going to turn this one over to you.
Say it one more time, sorry.
What should I know before I enroll as a provider to administer vaccines, and how long from enrollment until I receive vaccines and can begin making appointments?
Sure. So I think what we've seen over the last couple of days is when some providers are getting vaccine, they've reached out to us with questions about scheduling and things like that. I think it's important that when providers sign up as a provider to receive vaccine, that they have a system in place to do scheduling. It's important that when people are looking for a place to go get vaccinated and their site is going to be listed on the state website, if you get vaccine, you should do it with the expectation the state will list your site on the website, or a phone number or a link that you provide to us for scheduling online. So it's very important that as you enroll as a provider, as you work with us to receive an allotment, that you have that scheduling system in place. If you need help doing that, we can help you. We at the Department of Health has, we have a scheduling system that we can help set you up with. So I know we've seen, especially today, with some of the pharmacies that are coming online, have reported to us that they didn't have a scheduling system in place. We can be there to help set that up so that the administration is smooth and easy and can be done seamlessly.
Great, thank you. The next question comes from Ralph. If I have to reallocate doses 1 week due to my inability to administer all of my doses on hand within 7 days, will that prevent me from receiving doses in the future? Larry, do you want to take that one? Sure. If I have to reallocate doses due to not being able to administer the doses on hand within 7 days, will that prevent me from receiving doses in the future?
Listen, we want this program to be, as I said, the most successful in the country. So we want to work with you to maximize the number of people we vaccinate every single day. So under the use it or lose it policy, we really want to emphasize that whatever allocations you receive, that you're able to use that entire allocation within a 7-day period. If for whatever reason you can't, then just contact us and we'll reallocate whatever portion of your allocation and we'll work with you. Maybe all we need to do is reduce your allocation for the following week so you're able to maximize and get 100% of your allocation completed within that 7-day period. So what will be problematic is if you don't contact the state and you end up sitting on an inventory of doses at the end of the week. That could jeopardize a provider's ability to continue to participate in the program. I don't want to see that. Nobody wants to see that happen. We want to work with everybody that is motivated to be open every day of the week and turn this into a 24/7 operation. So I would just urge you, if for any reason you cannot administer every dose of your allocation within that 7-day period, as the guidance points out, contact us in the 5th day. We will work with you to move whatever allocation you cannot use, and we'll talk to you about reducing possibly your allocation going forward so you're not stuck with an inventory. But please follow the guidance. Do not sit there and start vaccinating people that are not eligible. If any provider were to start vaccinating people that aren't under 1A or 1B is in terms of the eligibility that we laid out, then you're in violation of the state guidance, and you're certainly in violation of no longer being able to participate in the program. So rather than panic and start vaccinating people that are not eligible under the state guidelines, just call us and we'll work with you to reallocate any unused doses.
Great. Thank you, Larry. The next question comes from Greg, and I'm going to answer this question. My son attends a day habilitation program and is considered a high-risk individual. Does he qualify at this time to receive vaccine? At this time, those who reside in OPWDD certified settings are eligible to receive vaccine. However, if they live at home or in the community, they are not eligible at this time. Next question comes from Arlene. Can we get vaccinated anywhere in New York State, or must we get the shot in our county of residence? Can take that one. Kristen, you want to take that one? Great.
So there is no requirement that you have to be vaccinated in the county in which you live. We've tried to make it convenient so that people could get vaccinated at or near their workplaces, for example. So if a healthcare worker happens to live in one county but works at a healthcare facility in a neighboring county, that individual would be able to get vaccinated at their place of work.
Thank you, Kristen. Go ahead, Larry.
Yeah, and one thing, I want to just emphasize in terms of scheduling an appointment, you should go, I want to just push that you go to the online website, the eligibility tool, to schedule an appointment, you certainly can use the call center, but I urge that everyone you talk to, you try to, that you first go to schedule your appointment online. It'll be much simpler and much quicker to do it that way. And I urge everyone to encourage your, anyone you know to make your appointment through the online eligibility tool. Thank you.
When we're working with DOH to sign up as a provider and we're in discussions about getting an allocation, and you have concerns about processing people through your urgent care center or facility, reach out to us well in advance and we can help you get set up with a system where you can do that. If you're getting an allocation for, the 70, especially 75 plus in your community or a pharmacy, we can work with you well in advance. We worked with several hundred pharmacies in advance of this week to get them set up. We have many more pharmacies we want to bring online. We can work with you to get set up. So once you get that dose and we add you to the state website where people in your county and local community can find you, you're all ready to go. There's a scheduling tool online, and it's all the expectations are laid out there. We know many of these sites are getting hundreds of phone calls, which is to be expected when you add this many people to the eligibility at once. But the advanced planning, a lot of the work that went in, I saw over the past couple of days, certainly has helped the process, and the expectations will keep doing that going forward.
Thank you. The next question comes from Joan. Will any sites be open to administer the vaccine without an appointment?
No. The answer is no. You need to make an appointment in advance. And by doing that, we're able to get a lot more vaccines administered because you've scheduled. So the answer is no.
Great.
One of the other concerns with having people just walk in for appointments, obviously, is that we are still living in a time when COVID spread is very much a risk. And so we want to avoid the potential that people would be essentially gathering at a vaccination place. So we are able to stagger the appointments to ensure that everyone is kept safe and everyone can properly socially distance, and all of the things that we need to do to ensure that there is not any COVID spread.
Great. The next question comes from Jane. And Dr. Zucker, I think this is a good question for you to answer. Will I be able to choose which manufacturer's vaccine I receive? I am highly allergic to the flu vaccine and would prefer the Moderna vaccine.
I think that this is where you work with your doctor. The vaccine that's available at the place you go would be the vaccine you would receive. But it's important for you to share this information with a healthcare provider who is going to vaccinate you. There obviously are questions in advance. I would mention that this is just because one has an allergy to the flu vaccine or to other things doesn't mean one's going to have an allergy to either these messenger RNA vaccines, which are the ones that Moderna and Pfizer, or other vaccines that will come up on the market. So I would speak with your healthcare provider about that. And there's always ways to give someone a medication prior to receiving a vaccine if they have a sensitivity or allergies.
And a similar follow-up to that from Barbara. Will there be individuals at vaccination distribution sites with medical training to deal with any potential allergic reaction? For example, at a pharmacy or retail outlet, what is the protocol if an individual receiving the vaccine has an adverse reaction?
Yes, so individuals at these sites are trained to address any of the medical problems that may occur, particularly allergic reactions.
There is a 15-minute monitoring period, so individuals who go to get vaccinated should anticipate that they will be asked to remain at the site for 15 minutes following the administration of the vaccine, and that's so that the site can ensure that individuals are safe and that they've tolerated the vaccine before they're allowed to go on their way.
Okay. Next question that I am going to take comes from Lori. I provide direct support to an individual who lives in an OPWDD residential setting. However, I am not an employee of OPWDD or the residents because I am employed by the parent. Am I eligible to receive the vaccine? The answer is yes, you are eligible because you work in the group home and have direct contact with the individuals residing in that facility. Okay, next question. If one makes an appointment, how will the second booster shot be handled or scheduled?
So the vaccination providers are required to provide a COVID-19 vaccination card to the individual, and it has to be completed with the date of their current vaccination, the manufacturer. So right now it would be whether you received Pfizer or Moderna, and then the date, time, and location of when the recipient has to return for the second dose of COVID vaccine. And as you heard Dr. Zucker say at the beginning, for Pfizer, it's 21 days from the first dose to the second dose, and from Moderna, it's 28 days. And I should also point out that it's imperative that if you received Pfizer in the first dose, you must follow up and get Pfizer in the second dose. And likewise, if you receive Moderna in dose 1, you must have Moderna in dose 2. You cannot switch between the two vaccines.
Great. Next question comes from Dennis. I reside in Rensselaer County, but when I tried to schedule an appointment, they said they do not have vaccine yet. Is there somewhere else I can go? So I think the answer here is that the Am I Eligible tool has multiple sites listed in a county, and if you are not able to secure an appointment at one of the locations that you try, you can continue to try the other locations. Yes?
I could also add,
Yep.
when you go into the Am I Eligible tool, if you are eligible and you are allowed to, you're able to go in and look at sites that you might select from, it will ask you how many miles you will be willing to travel to get the vaccine. So you can select in different increments the number of miles that you could go. And it may also be that you live in one county, but you're closer actually to a site in another county because you live on the border between counties. So that's, again, why we haven't put county by county restrictions about where you can go, so that in addition to living in one place and working in another, if you're on a border county, you have the flexibility to go somewhere else.
Great. Next question comes from John. Will there be any large state-operated facilities that operate on a 24-hour basis?
Currently, I don't believe the facilities are operating on a 24/7 basis, but to the extent it's necessary, I think what the governor has been saying, what we've been saying, is the issue here is going to be supply. But the goal of our operational approach is to build a delivery system where at the end of every week, there's no more vaccines left on the shelf. And to the extent that a supply increases and we need to expand the capacity and throughput of our sites, state, county, private, we will do everything we can to do that. But my understanding is for now, these sites are not 24/7.
Great.
But not 24 hours a day.
Next question comes from Brent. If my employer is creating a list of employees who want to vaccinate our employees, do I need to wait, or can I register myself online and make an appointment on my own? There
would be no, I mean, if you're an eligible population, I think if your employer is enrolling your workforce, would make practical sense to go through that method. Would be no restriction if there's another site where you would be eligible to be vaccinated and you're in that eligible group, there would be no restriction on that. Again, our goal is shots in arms here. So I think it makes sense to go through your employer, but there would be no restriction on that.
I also just want to emphasize that with the essential worker groups, it's where you work, not where you reside. So we want to make sure that everybody that works here in the state of New York gets vaccinated to keep them safe, but also keep all the people that they come in contact with safe. So I just want to emphasize that if your residency is outside, but you work in New York, you're eligible to get a vaccine shot.
Will there be any drive-through options for the public to be vaccinated at?
Yeah, certainly. And some of the state-run, and I know some of the other even non-state-run sites that are being in creation now will be drive-through.
Okay. Next question comes from Brent. I am an FDNY EMT, and while I am grateful that EMTs were prioritized to receive the vaccine, I wonder when other household members will be able to also receive the vaccine.
Listen, we want to get everybody vaccinated as quickly as possible. And as Governor Cuomo pointed out, and I've mentioned it, we've all mentioned it, you know, we're handcuffed by the number of doses that the federal government is providing New York State each and every week. And just over the fact that we've opened it up to these two eligible populations of 5.3 million New Yorkers, to date, we've only received 1 million doses of vaccine. So, you know, the key here is the federal government's got to come up with a way to massively increase their allocations to the states or set up their own federally run mass vaccination sites in order for us to be able to get people vaccinated sooner and quicker, as well as expand the population group. So right now, you know, we're focused on our older population that's much more vulnerable to getting seriously ill if they contract COVID, as well as many of our essential working groups. That's important in order to, you know, keep services running, keep our economy open, and also provide key quality of life services for the public. So we'll be able to move faster and grow our populations as soon as we can get more allocation from the federal government.
And I believe this is our last question. It comes from Jenna. If I am vaccinated and exposed to a COVID positive 19 individual, would I still be required to quarantine? Dr. Zucker,
Yeah,
maybe
sure.
that's a good question for you to take.
So the recommendations are to adhere to the necessity to basically quarantine. The CDC addressed this in the following way. They said that you should use all the existing tools that one has. So that includes mask wearing, washing your hands, and also a quarantine. We are still learning about this virus, and we're still learning about how it spreads. And though your immune system obviously has developed an immune response to the vaccine, as we know, with the 95% response that we've seen on the trials, we still recommend that you stay in quarantine at this point until we have more information. So that is consistent with what the CDC is basically saying. I would add one other thing in response to what Gareth mentioned before about the drive-thrus. We would still want someone to wait 15 minutes after. So with the drive-thrus, we'll have a place for someone to basically just sit there for 15 minutes to be sure everything is fine prior to driving away, if they were driving the car. Thanks. And right, I think that's important.
There would be personnel there in those waiting areas after the drive-through administration to ensure that if there were any kind of reaction, which is unlikely, but just to be proceeding with an abundance of caution, those would be monitored as well.
In the millions of doses that have been given across the country, there's only really been a handful of individuals who have had significant allergic reactions that we've read about on those couple of cases over the course of the past month or so.
Dr. Zucker, that concludes our question and answer period. I just want to reiterate to those tuning in, if you have any additional questions, please feel free to email, and we will try and get back to you. The email address again is vaccinate.ny@exec.ny.gov. Any closing remarks?
Thank you, Megan, Larry, Kristen, and Gareth. And thank you all for making your efforts to help New York vaccinate everybody in our state. We will all get through this. I look forward to the day that we have our herd immunity, which, as you've heard, is in the 70 to 90% vaccinated. We need as many vaccines we can get from the federal government, and we need vaccines in everyone's arms. So I thank you all for working with us on this, and have a good evening. Thanks.